Good afternoon, Albuquerque, and thank you for joining Mayor Tim Keller's Coronavirus Update Telephone Town Hall. This is our third telephone town hall in the last month as we work to keep everyone updated in Albuquerque. For those of you wondering if you are connected, you are. Right now, you are in what is called listen-only mode, which means that you can hear me, but I cannot hear you. In just a moment, we will introduce Mayor Keller and other city leaders, and then we will open it up for questions. But first, let me go over a few housekeeping items. If you would like to ask a question, you can press *3 on your phone and you will be put into line to speak with one of our staff members. Again, if you would like to ask a question, please press *3 on your phone and you will be put into line to speak with one of our staff members. They will hop on, take down your name and your question, and then you will return to the town hall. Then, if you hear your name, you will be live to the entire conference and can ask your question directly to Mayor Keller and city leaders. We'll do our best to get to as many questions as possible, so please press *3 right now if you'd like to ask a question. Again, press *3 now if you'd like to ask a question. Along with Mayor Keller, we also have a number of city leaders joining us today who can speak to some of the specific questions folks in Albuquerque have been asking. We have Ana Sanchez, our Director of the Department of Senior Affairs. We have Dr. Shel Sanchez, the Director of our Cultural Services Department. We have Dr. Mark DeMena, our Deputy Director for Environmental Health. We have our Deputy Chief of the Albuquerque Police Department, Harold Medina. And we have Charles Ashley, Board President of the One Albuquerque Fund. Now, I would like to turn the conversation over to Mayor Tim Keller for some initial remarks before we jump into the questions. Mayor, go right ahead.
Well, good afternoon, everybody, and this is Mayor Tim Keller, and I want to thank you all for joining our third telephone town hall. I know there's so much to discuss and so much that's going on, in addition to some beautiful snow on the Sandias this morning. We also, as most of us last week in one way or another, we're either trying to celebrate Easter as best we can, or for my interfaith family, it was actually Passover and Easter. And we're all discovering new ways of trying to find ways to be together, even though we have to be physically separate or at least distanced. And I know that that can be frustrating and challenging on everyone, but I want to thank folks for trying to flatten the curve, for trying to honor what we're doing, and for being in solidarity with our healthcare workers and our first responders and our grocers and everyone that we're trying to keep healthy so that we can keep our city running, and also, of course, so we can keep those critical beds available and ventilators and so forth in our hospital system. And at least so far, Albuquerque has done a great job. We have always ways to do better, and we're going to have to keep doing this for quite some time, and we'll talk about that in a little bit. But so far, I think in many ways we are leading by example. Of course, there's more we can do, and we've got to keep it up. But I do want to thank everyone for the part for the part each of you are playing in making this curve flatter and in keeping our community safer. Now, a few quick updates from the city that I want to share with you before we get to questions. First, today we announced our first 140 micro-business grant recipients. And so this was a program that we set up through our Economic Development Department, and it was really trying to fill a gap that we know is so real for so many people in our city. And it's the gap of the challenges that we're facing with our small businesses, but it's also with respect to, we know there's lots of great programs federally. The PPA program is finally starting to actually process applications. We know there's different debt programs at the state level, but we heard loud and clear that people also just needed a amount of money to get them through 1 month of a very short payroll time or paying rent to literally stay open, and especially for businesses 5 people or less. So that's what this program was designed to do. And so at least for 140 folks, we really made a difference. Several of them actually were in tears when we told them that they had been selected. The downside is that, we had over 1,000 applicants for this program. And so we'd love to do more, but we only have a certain amount of funding available that we were able to kind of scrounge up. So we're going to talk a little bit about different ways you can help, but one way is to donate to our One Albuquerque Fund. And if you want to earmark it to whether it's motel vouchers or our micro business fund, you're more than welcome to. But this program just shows the demand that we have for help right now is so real. And in some ways, the best short-term thing we can do in this case was just a $5,000 check for 140 businesses without a lot of criteria or strings attached, and it's not a loan. It's just something to make sure that they can actually not permanently go out of business. So we're also trying a similar approach with our Creative Economy Relief Fund, and this is still open till Friday. So I do want to let folks know they can learn more at cultureabq.com. And this is a program that basically we've been able to shift some existing money into telling our creative folks who now have no audience, right? So whether it's a theater or a production or an artwork, all of that is on hold right now. But it's a core part of who we are as a city. It's a core part of our economy. And it's something that we're going to try and both celebrate and support as best we can at the city. And so you can apply to a slew of programs with respect to that, again, through cultureabq.com. Also, in the last few days, we rolled out our Wi-Fi on Wheels program. And this is really about trying to close the digital divide. So now if you see a Sunvan bus parked at a parking lot, it's because you can access free Wi-Fi. So what we did is we basically amped up all of the internet coming out of our community centers. So now you can pick it up in the parking lot and use it for free. And then we also outfitted some of our Sunvans that weren't being used as much with the same capabilities. So we're putting those Sunvans at schools right now where the lunch drop-off programs are, so kids can download their lessons and so forth and use the internet if they don't have it at home. Now, it's no substitute, of course, for home internet and the digital inequities that we see throughout our society and in our city, but at least this is one way in which folks can log in if they need to all over the city. Now, we're also, again, trying to support those most vulnerable, those most in need during these times, and some of that has to do with childcare. And so the city continues to offer childcare for all ages at our community centers for emergencies only, and for our sort of first responders and public health workers, essential workers that have no other choice. That program continues to run at most of our community centers around the city. And this week we're also opening up the early childhood piece of that. So the standard program is for 6 years of age and up. And now, again, we're continuing for public health workers, essential personnel. We're able to offer early childhood care at a couple of our facilities. So all of the details on this are available online. So in addition, the last thing I want to mention is, of course, our kind of open space and park situation. Our city is so blessed to have some of the most acres of open space actually in the country on a per capita basis. It's part of also what defines how great our city is. And right now we've been able to keep our open spaces open and our parks. But this is in many ways sort of a public compact with each of you, in a sense that as long as we follow the social distancing rules, you enjoy the facilities and the space and then go back home, we can keep them open. If they're abused or overused, then we're going to have to close them. But last weekend, actually, Albuquerque did a great job. And stay off the playgrounds as a reminder and any of the equipment. And also try and utilize either lesser-known playgrounds or lesser-known open space. We have a lot of open space, for example, up by Fort Hills, all over the petroglyphs, although those have been actually quite busy. But we even have some in the Manzano Mountains and in the East Mountains. We even have some in Placitas. And so it's a great time to take a road trip and enjoy our open space. And again, enjoy it, maintain social distancing, and then come on back home. So I think with that, we want to save time for your questions. So I'm going to wrap it up and hand it back over to Alan for questions.
Great. Thank you very much, Mayor. And thank you again to everyone who is participating with us for today's telephone town hall. If you're just joining us, if you'd like to ask Mayor Keller and city leaders a question, press *3 on your phone, and that'll connect you with our staff members. Again, *3 to ask Mayor Keller a question, and you'll get connected up with our staff members. Mayor, right off the bat, we're seeing a number of folks with the same kind of question. So thank you to Petra and Ann and others. And their question is, how long do you think this all might last?
Well, Petra and Ann, that is a question I think at the forefront of all our minds. And I can provide you with at least some guidance. No one knows exactly how long this is all going to ask. But here are the parameters that I know myself and other government officials are looking at. It's basically a function of three factors. Number one is the availability and turnaround time for testing. So as we think about opening up or when we open up, key to that is being able to get people tested really quickly and get the results really quickly, so then we can, sort of pull them out of, circulation so that they don't get others sick. So that's key number one, and we're still not there on testing, so we got a ways to go there. Relatedly is the number of ICU beds and the number of ventilators available. So this is another situation where the flatter the curve, the less cases that we have, then the fewer beds that we need. We do know right now, based on projections, New Mexico is still a little bit short when it comes to ICU beds and ventilators. That's why we're opening up. The state's working on the Loveless Old Hospital, opening that up. I know there's another one in Gallup. I think there's another one that the state's working on. So the longer this goes, the more our healthcare system has time to ramp up the number of ICU beds and ventilators. And once that ramp up is complete and the curve hopefully stays flat, then it's we get a sort of green light to again look towards opening. So we are not there yet, but that's another factor that we're looking at. And then the third factor is community spread. So we need the community spread rate to basically be lower than the number of tests available and ICU beds available. So when you put all those three together, you actually get a fairly simple equation that tells us when we can open. But what is much more difficult is understanding the assumptions behind each one of those. So that's what we're looking at, and I think this is very sort of science and fact-based, but that's for good reason. And I will tell you that right now, the various CDC and Johns Hopkins and others, we're looking right now, again, it could change tomorrow, we're looking at a peak around the end of April. And we're hoping that at the end of April, we will know that the rate of change will go down going forward. And hopefully by that time, too, we'll have, again, increased beds and resources and so forth. So that's a real key inflection point. So the short story is we have no more visibility for the next 2 weeks. But after the next 2 weeks, we should have some visibility about when we can open up again.
Great. Thank you very much, Mayor. And again, thank you for joining us. If you'd like to ask Mayor Keller a question, please press *3 on your phone. Again, to ask Mayor Keller and city leaders a question, press *3 on your phone, and you'll be connected with our staff. We're going to go to our first live question now, and it's from Joseph in Albuquerque, who has a question about PPE. Joseph, go right ahead.
Thank you. Can you hear me?
Yes.
Okay, great. Mayor, thanks for taking my question. You answered part of it earlier, but do our doctors, just watching the national news, it seems like there's still like a nationwide shortage for PPE equipment for our doctors and nurses and the ones that are on the front line. Does Albuquerque have what they need right now as far as PPE equipment?
Thank you so much, Joseph, for that question. And it is one, it's so true. I mean, any national news is just dominated in parts by this issue. And let me tee up Dr. Mark DeMena, who really runs this up for Central New Mexico for us, our Deputy Director in Environmental Health. So I'll let him give a specific answer, but in general, our community is doing much better than nationally, but it's still a big concern. And we're sort of managing a stockpile of reserves. So, Mark, if you want to take over from there, that'd be great.
Yeah, thanks, Mayor. I think exactly as you said, this is something that we're hearing about consistently in the national news since this started. It's really an international shortage issue, so it's affecting us here just as much as it is anywhere else. Currently, there is PPE available. We know that some of the systems are getting fairly creative. There have been a few things that have come down that have alleviated a little bit of the pressure. The availability of use of the KN95 mask, which wasn't previously allowed. Some sanitizing measures to be able to reuse masks. But where we're asking the public generally to do face coverings when you go out, that's really where we're asking people to protect others in case you're already infected. When we're talking about healthcare providers, they need to assume that the people that they're interacting with are infected and protect themselves. So a simple cloth or a DIY face covering is not really appropriate for them. So we're having very much, I'm sitting every day at the Emergency Operations Center here and listening in on what's going on with some of the logistical issues with that. We're having to try to meet the requests of any PPE requests coming in, but having to ration these things out very carefully and asking people, please don't waste, please, be very careful to use what you're getting. Right now, I think that the short answer I could have maybe started with is, there is still PPE available, but we really are going to have to continue to watch that carefully. That's one of the reasons why this concept, the strategy of flattening the curve is so important. The hospitals don't just get overwhelmed in terms of the beds available and in terms of the ventilators available, but also in terms of the PPE that's available. All of that stuff has to be used for testing, for treating patients, even for treating patients that aren't necessarily COVID positive. So it is very much still a concern, but so far we're keeping ahead of it.
Great. Thank you very much, Dr. Demena. And thank you to all of you who have joined for today's call. Again, if you would like to ask a question, please press *3 on your phone, *3 to ask a question. Next, we're going to go to Barbara, and Barbara has a question about essential businesses. Barbara, go right ahead. You're live on the line.
Thank you, Mayor Keller. You're doing an excellent job, as is our mayor. This is an essential season for gardeners, and I see Lowe's and Home Depot doing blockbuster businesses while the locally owned greenhouses, and I can enumerate 4 or 5 of them, have to remain closed. It just doesn't seem appropriate to me because this is gardening season. In a couple months, the window and the fresh plants, the things that gardeners need to do will, it'll be too late or at least partially late. So I'm wondering why that decision was made and, might it be moderated?
Barbara, thanks so much for that question. And I know even in our own house, we've been trying to do our planting and so forth, and it's actually been the limited planting that we've done has been wonderful for the kids that are home from school. But, your question, you highlighted, I think, a very important challenge that we're having, which is that these closures and public health orders are disproportionately helping big box retailers and hurting small businesses. And so this particular nursery distinction, I think there's 2 things I can share. I agree that it's a real problem with our local folks, Reams and others I know. So we are asking to have that clarified one way or the other. I think it was something that, folks, it just sort of happened, and we're hoping the state can clarify that. So that is kind of under state control, but that issue has been raised, and I'm hoping for some further guidance soon. Now, with respect to the big box, it was sort of the opposite. You saw over the weekend that we really had to clamp down, and I'm just sharing this because I shared it publicly before. Lowe's was having this huge spring sale, as you mentioned, and even their employees were calling me saying, this is just wrong. The place is packed, and the employees were concerned about their health, et cetera. So this weekend, we actually went in and forced them to comply with a city emergency order with metering, so they can only have this 20% fire marshal capacity. We're requiring them to have somebody in charge of that, so there's some accountability, and we put a lot of details around that, and actually our departments, our fire marshal has been helping to enforce that. So I think we hopefully came a long way and worked on this problem on the big box side. On the small nursery side, we're awaiting further clarification from the state. But I certainly agree with you in principle, and hopefully we can get that remedied statewide.
Great. Thank you very much, Mayor. And again, to ask Mayor Keller and city leaders a question, press *3 on your phone. Please press *3 to ask a question, and you'll be connected up with our staff. Next up, we're going to go to Irene. And Irene has a question about masks. Irene, go right ahead. You're on the line with the mayor. Irene, are you there? Nope. Looks like we might have lost Irene, but I'll go ahead and paraphrase that question for her. She had a question about the best way to wear masks and what's the right way to wear masks.
Thanks, Irene. Well, the mask question, there's lots of guidance available on the internet, and I'll tee up Dr. Demena to maybe point to some of the scientific pieces. But overall, here's in general, I think, some good guidance. Any face covering is better than none. And so that's why even if it is a bandana or a scarf or something like that, it is helpful just because it reduces the number of water droplets that are coming, out of your own mouth and so forth. Now, there are certainly better fabrics and ways to do this. So if you get to different types of cloth and you also use two sheets, like two pieces of a sheet or pillowcase, then it gets much, much better, much more effective. And then obviously that goes all the way up to these different medical grade masks and so forth you can use. And so Dr. Mark Demena, if you want to kind of chime in a little bit on that, but I think a rule of thumb is anything is better than nothing, and keep trying to get smaller and smaller levels of porosity in the fabric. So go ahead, Dr. Demena.
Well, thanks, Mayor, for stealing my favorite word on that. That was going to be how I was going to drive it home. But that's exactly right. We really want a mask, and when we talk about masks, we're talking about cloth face covering. So I guess the number one rule is this is not a good time to try to scrounge up an N95 or a surgical mask. If you have access to those things, think about the healthcare providers, the first responders, the frontline people who really need it more. And because, as we mentioned earlier, there's this worldwide shortage, that kind of stuff is not really going to do what we're asking people to cover their faces for. The entire idea with this, the reason that the whole country's shifted direction on this is that we're now assuming there's so much community spread that most people have probably already become infected. And that's not meant to scare people. It's just a philosophy to adopt when you go out in public. If you may be infected, you don't want to spread to other people, especially the ones that are still at work and trying to keep the city afloat, all the people in restaurants and stores and that type of thing. So you're trying to catch any respiratory droplets that come out of your own mouth. The denser the fabric, something that if you can put your hand to your mouth and blow through your mask and feel the air coming out through the face covering, then that's probably not doing a great job of catching any droplets. The face covering that I'm wearing every day has two layers of material. The inside one is flannel, and flannel has a really high restriction rate for stuff moving through. So if you've got some old pajama pants or the kids have something around you can cut up, that's a great fabric. Once I blow through that two layers of fabric, I can't actually feel the air from my mouth. I can feel it getting warm, but I can't feel air coming out. So I know that I'm doing a good job of catching those droplets. It doesn't need to fit super tight, but it does need to cover over your mouth and nose. There's some belief that even like talking or breathing expels some droplets because it's highly infectious. That's something we don't want to get onto other people. And I'll just close by saying both the Department of Health here at the state level and the CDC have some excellent videos on how you can make your own face coverings. There's some excellent stuff out there on YouTube in general as well. There are lots of creative ways that you can do this with things you already have at home. And then, if you want to get colorful and have fun with it, it's a great time to express individuality you might not get another opportunity for. But again, the most important thing is just cover your face when you go out to try to protect other people in case you are a silent shedder.
Great. Thank you very much, Dr. Demena. And a reminder to those of you who are just joining us, you can press *3 on your phone to ask the mayor and city leaders a question. Again, *3, and you'll be connected with our staff to ask a question. Next up, we're going to go to Scott. And Scott has a question. We heard about our support for local businesses, but he's got a question about help for individuals who might have lost income. So Scott, go right ahead.
Yes, hello, Mayor. Hope all is well with you. My question is, so with the focus basically has always been on businesses, whether that's small or big box businesses. what is basically being done for like individuals that have been affected by the COVID outbreak and in the sense of losing their jobs? Right now, I'm unfortunately one of those people, and there definitely isn't a whole lot out there right now because nobody's really hiring, so it's kind of making paying bills and things of that nature getting a little hard.
Thank you, Scott, and so sorry to hear about your situation, and just hope you can hang in there. And I think there's some things that might be helpful. So I'm sure you've tried some of these, but just for others that are on, number one, definitely try and file, of course, for unemployment as soon as you can. We know there's been a big backlog for that, but the online system seems to be working pretty good, and they now have longer hours. They seem to be able to process. So it's worth it, obviously, financially. Just keep trying. And they're also adding at the state level for all individuals, the unemployment system that we have. I mean, this goes back to like the Depression, and thank goodness it's there. It is the safety net, and so use it. I think that's the biggest thing. And right now, too, they're adding $600 a week starting April 20th to that program, which is going to help. So that's, first and foremost, definitely utilize that system. And again, I know it's been frustrating, but it's worth it just to keep trying to get in. So that's the most important thing. And I think for us right now as a city, what we're trying to do is make sure that people get those benefits, because a lot of those are reimbursed federally and so forth. So, the good news is I think they're dependable. As long as you can get through into the system, they are going to work as designed. And we're going to be able to ride this out, hopefully. The second thing is there are, if you're really in some dire financial situations, we have put up some kind of emergency type services. So, for example, there's a rental assistance program that we've put up that I believe still has some funding available in it. You can call 311 to get information on that. We also, even if it comes down to food boxes and this kind of thing, we have 4 public service emergency centers in each 4 quadrants of the city. And so if you are having trouble with basics around, food, you can get a food box there. They will help you with unemployment, with food stamps, things of that nature. So that safety net is still operating, and I would just sort of get on it as soon as you can to buy yourself time for the economy to shake out and, hopefully for a lot of us to get back to work. So other than that, keep an eye out. There are some areas that are still hiring. So just depending, obviously, on your background and what you're interested in, there are even the city, for example, for certain areas, we're in desperate need of security folks and bus drivers. And also, I think this is a good window to tee up 2 folks who are on the phone. One is Dr. Shel Sanchez, our Director of Cultural Services. Shel, if you could talk a little bit about your Creative Economy program. And then we also have Charles Ashley, who runs our One Albuquerque Foundation. And so they might have some insights in this area as well.
Hello, Mayor. This is Shel Sanchez, Director of Cultural Services. And this week we were able to put out some opportunities for the creative economy, which is very much often individual solopreneurs, people that work for themselves and often work in what we call the gig economy. So when they lose their job, it's kind of hard to file for unemployment because they don't have an employer. They were their own employer. So there's several programs that are out there. One of them for our arts nonprofits, actually that opportunity ends today, so applications are due at 5 p.m. It's not a long application, so if you're an arts nonprofit, you still have time, and you can find that at the City of Albuquerque's website at Cultural Services. And then for our creatives, and we define that very broadly, we are taking proposals for DIY media, so do-it-yourself media creating interesting media that's responsive to the times that we're in right now for our community, and then we're going to fund as many of those as possible, ranging from $250 to $2,500, depending on the number of hours and if it's a series of programs where we'll contract with individual creatives. That media will then go on our public access channels and then also be streamed for our community through our YouTube channels. So those are just two of the examples of things that we have, trying to be very responsive to this exact need, individuals who have lost their source of income, specifically in our creative economy, which is about 10% of our workers here in Albuquerque. So it's a big sector for us.
You know, I'd like to and this Charles Ashley III, president. Sorry, Alan. Charles Ashley III, president of the One Albuquerque Fund. We, as a board, acted 3 weeks ago and allocated approximately 50,000 to housing vouchers, and that is something that you can go look up at onealbuquerque.org, where you can get more details, and that provides vouchers for hotels and motels or whatnot, and it's our way of saying we know that everyone is going through difficult times, and we want to figure out if we can put some funding where it could be used immediately. We're also discussing later today, matter of fact, where we're going to put more funding into the city or whatnot. I know we were discussing micro loans, business loans, type of relief things. So that's what we're doing as a fund to do our part in the city.
Great. Thank you very much, Charles and Dr. Sanchez. I appreciate all you're doing for the city. And again, the website Charles just mentioned, onealbuquerque.org. As Mayor mentioned earlier on this call, you can support local businesses, you can support individuals in need, and you can learn more about those efforts over there. Again, *3 to raise your hand and ask a question of Mayor Keller and the city leaders we have on the line today. *3 to ask a question. Next, we're going to go to Diana. And Diana has a question about food access for seniors. Diana, you're live on the line. Go right ahead.
Thank you. Thank you, Mayor, and thank all of you for helping us, seniors. My question to you, if the seniors don't get a stimulus check, I don't care if it's for $100 or $200, how do you expect us to go buy groceries for 2 weeks on $25 a month food stamps? Now, I heard on the news where the food boxes are going, where they're giving them out, and everybody's rushing over to get them. Then when the seniors go to get their food boxes, they can't get none because of greedy people who do not need them go and get them, and this throws the seniors out without food. And it's not fair. I mean, and people in electric chairs who can't go, people like me, 100% blind. I got a very, very bad heart. I've had 14 heart attacks, 9 strokes, 16 heart surgeries. I got 5 valves in my heart. How are we supposed to get over there to get one of these boxes for food for us to eat?
Thank you very much, Diana. Mayor?
Well, Diana, thanks so much for your call. And I know this is a really tough situation, especially in the situation you described personally for you. And I have heard of these challenges. I think there is some hopefully good news here in the city of Albuquerque and actually surrounding Bernalillo County area. Our Senior Affairs Department has a meal delivery program that is actually very well run. It's been around for a long time, but they have now delivered like 30,000 meals and counting. It's well over 1,000 a day. And I believe our Director of Senior Affairs is on the phone, so I'm going to tee her up. But the short answer is if you call 764-6400, we can arrange a hot meal delivery for you Monday through Friday. This is also available to a lot of folks in different ways. And our Senior Affairs Department, again, a shining star actually around the country for what we're doing for our seniors. Anna, would you like to go into more of that for us?
Yes, thank you, Mayor. I really appreciate the question from Diana. And certainly just to echo, our department is working very, very hard to ensure that food services is our main priority to make sure that our seniors, our most vulnerable population that could be susceptible to this virus, is taken care of, and just appreciate the commitment of our staff. So just to echo exactly what the mayor said, we have our home delivery program that is available. Contacting that phone number at 764-6400 is the best way to get the proper information that we know we're to be able to deliver that meal. And the mayor has echoed it right on the head with that we are doing an increased amount, but we are servicing folks every single day. And then we also have our pick up and go meal sites. We have 5 locations of our senior affairs facilities that we are doing pick up and go meals. That's actually faster than Wendy's is what we're joking, but a better meal. And we have those available between the hours of 11:30 and 1 o'clock, Monday through Friday. We also do have available food boxes that our department has organized with some other partners. So we also can be able to bring those items to seniors that are in need, because we recognize, such as Diana, that there are some limitations that folks have, and we know that they at this time are not leaving their homes on their own. So just certainly to echo that we have a variety of food services available for our senior population, and we all still doing our transportation in case somebody does need a special trip to the grocery store during senior hours that we want to make sure are available to them. So we also can be able to schedule rides specifically to ensure that our seniors get what they need. So please contact our 764-6400 number, and we are excited to be able to help you at this time and make sure that you are okay.
Great. Thank you, Director. And we're just going to keep rolling on to calls here. Again, *3 if you'd like to ask a question. Next up, we have a question from Judy. And Judy's question has to do with how the state and the city are working together and how that's all going. Judy, can you go right ahead, please?
Hi. My first concern regarding that question is how the orders that are sent out by the state for protecting us all from the coronavirus are being enforced. I really haven't gotten a good answer on that. According to the state, they're making it kind of vague, and I haven't heard anything from the city that was very specific either. So it's very important that these orders are enforced, or people are going to disregard them. I've seen that happen recently with total disregard for them. So please answer that question. Thank you.
Thank you so much, Judy. And a couple of pieces on this. The first one is that basically in the beginning, when an order is issued, it is very much as you describe it, where there's just an order that's issued and enforcement has to come, hours and maybe a day or two later. So I'm just being straightforward with the reality of with which the speed of these orders had been coming down over the last few weeks. Now, the governor and I are in personal communication as well as our teams. So we do try and work and prepare in advance and think through things. But sometimes it can take a few days to figure out exactly how to enforce things, or like the earlier call around nurseries versus big box and so forth. We're learning as we're going. But what I can tell you from the city is some very specific things around enforcement. So in general, enforcement is being handled by the state. However, in Albuquerque, we made a decision to step up with enforcement in areas that we thought were especially problematic. So what we have done is we actually have had 500 plus citation or communication or warnings issued with respect to businesses that should not be open. So starting about a week ago today, APD began enforcing that. But I want to let you know we're only doing this in egregious situations. We've found dozens of, for example, smoke shops and massage parlors. Some of them actually, refuse to close, and so we find now 2 of them. Others were just following orders from corporate, and they needed a stronger message. Conn's Furniture was a good example of that. The employees were like, look, we're just doing what we're told. We agree with you, but you got to talk to corporate. So we did, and they're closed now. So nursing homes is another area. Our environmental health department last week reached out to 158 nursing homes, and we issued strict orders on what they're supposed to be doing. And even open spaces, we had 12 citations last week in open spaces. So again, what we're trying to do, at least in Albuquerque, we're trying to enforce, egregious situations that people are either, sort of flaunting, getting around the rules, or we believe, there's just too many people mass gathering, and so we're enforcing that. And we do it in a way where, first folks just get a warning or they have a conversation, and then there's 3 levels of enforcement. But we are doing that. Now, I will say that is really the extent to which we're doing. And that is because, especially for our police folks, we are still fighting crime. So if you'll notice, most of our crime numbers are slightly down, which is, of course, a good thing. But we need our first responders responding to emergencies. And so that's why we just have to be very careful. We want to do targeted enforcement of these public health rules to make sure that our city's in the safest possible place, but also keep taking those 911 calls, because that is still a reality in our city each and every day. And so that's what is, of course, taking up the bulk of most of our public safety resources. So hopefully that provides a little bit of clarity, at least what the city's doing. And, at the statewide level, I would really have to direct, those detailed questions over to the state police and so forth. I know they do have a hotline, which is very helpful to call. So you can call 242-COPS or at least call the state hotline, because I do know that they are tracking that. And that's going to help with enforcement as well. So we'll make sure and get that information out on social media, and I'll get you the number here in just a minute.
Great. Thank you very much, Mayor. And again, *3 if you'd like to ask a question, *3 on your phone, and you'll get connected with our staff. Our next question comes from Paula, and Paula has a question about community internet. Paula, go right ahead. You're on the line.
Hi. I'm just wondering, I know you probably had this question before, and it's probably fraught with politics, but I'm wondering what the possibility is of us having a kind of public works project where we create our own community ISP or Albuquerque internet service provider.
Thanks, Paula. I love that question and that thought, and it's a good example of how, sometimes times of crisis can really push us down a path that we should have been going down anyway. And so this is something that actually I'm very interested in. And we even put out an RFP for community members to do this when I first came into office. And so it's something I would like to do. I think we're missing that private partner. In other words, even if it's a community internet service provider, we still need some individuals who aren't the government, like a nonprofit or even a neighborhood, to be interested. So if you know anyone who is interested and so forth, I think it's a good idea. I think we should actually put that back out to bid. So I'm going to take a note here, and we can do that. In the meantime, we're really trying to demonstrate this with our public drive-up Wi-Fi situation. So again, a little different than community wireless, but if I can do it budgetarily, we'll just keep the internet turned up outside our community centers anyway. Ironically, this was an idea I had when I campaigned for this job, was to just have free wireless in the parking lots and parks near our community centers. So I am actually going to try and do that. I haven't cleared that with our own team, but I like your idea so much that I am going to try and do that. And in the meantime, we'll look at maybe reissuing that community wireless RFP as well. So I do want to touch base really quick just on the previous question about the number to call and state police. We actually have our Deputy Chief of Police, I believe, on the phone, Deputy Chief Medina. So we want to get to some other calls, but Deputy Chief, if you want to just chime in briefly on enforcement in Albuquerque, since you're on, we should take advantage of your limited time, and feel free to share whatever you'd like.
Thank you, Mayor, and hello, Albuquerque. I think one of the best things that the Albuquerque Police Department did early in this process is we developed a form that went out and gave official notice, and it made it a little more legitimate that somebody was getting a warning violation. And once we issue this form to the individuals, letting them know in writing that they have violated the health code, and if we return, the second time we get there, they're going to get a citation, and the third time, we're going to forward the case for prosecution and for possible fines from the civil side up to $5,000. I think that's really set the tone, and most businesses are complying with this. We have very few businesses that have not complied with this. We've only given about 4 citations, but our goal from the beginning was to work with the community and educate the community and make sure that we took into understanding that as a community we're in a tough place. So we will continue to work, and if somebody truly deserves a citation and needs one to close, we are not afraid to issue the citation, but we're hoping that people continue to cooperate and work with us because it is better for the community if we could just come to agreement all on our own. Thank you, Mayor.
Great, thank you very much. And I think while we have Deputy Chief Medina here, we'll stay on public safety for a moment. We have a question from Tony, and Tony's got a question about safeguards for small business owners. Tony, go right ahead.
Hi, can you hear me?
Yes.
First of all, Mayor, I want to tell you thank you. As a business owner, I think that you are making the right moves because as small business owners, if we get sick, we can't make any more money. So when it comes to owning a business, criminals don't care about your curfew, your bans, or anything of that nature. When I hear you say that crime is down, that means to me that less people are getting caught. What are our safeguards as business owners, not frequently our places, that, you know, what's going to happen with us with criminals breaking into our places because we're not there?
Yeah, Tony, thanks for that. I appreciate just the encouragement and also the reality that you're speaking to. Our Deputy Chief Medina, who's in charge of all of the field officers, he can speak to this better. But what we are worried about is commercial burglary, especially because that is one category, as you can imagine. While residential is down because everyone's home, commercial we're having more problems. So I'll hand it over to the chief to speak directly to you on that one.
Tony, this is Deputy Chief Medina. You know, like the mayor said, commercial burglaries, we're not going to hide the fact, and we've made this known publicly in the past, that we are seeing an increase in some of those commercial burglaries around the city. But we also have used our resources to the best of our abilities and made sure that we're devoting resources where we need to. So, for example, our traffic unit, we're using them to give all the citations on the public health order so we could keep other units that are responding to calls and protecting the community available for calls for service. So one thing that you could do to help protect your business is simply call the 242 COPS phone number and ask them to set up a welfare check at your business so officers can check it periodically during the night. Another thing you can do is get a hold of your local area command, and most our area commands are open to the telephone business, normal working hours, and they can also set up a welfare check at your business. And then continue to monitor your business. Drive by there, make sure that everything is fine, and make sure that if you see anything suspicious, let us know. But we are out. We are specifically focusing on commercial burglaries and making sure that we do everything we can to safeguard all the businesses in the community, because we know when this is over, everybody's going to have to go back to work, and they're going to have to make up for lost time. So we are doing a lot. We do recognize that was one of the problems we're having, and we'll continue to proactively make sure that we have resources available to safeguard the community and use our resources to the best of our abilities and direct them in the right places during this time.
Great. Thank you, Deputy Chief. Next up, we have a question from Kevin, and we're going to try and get a couple of questions in here before we run out of time. Kevin's got a question about our libraries. Kevin, go right ahead.
Hi, Mayor. I just wanted to thank you for everything you're doing for our city. I appreciate it. I had a question. Is there any way we could set up, have one or two libraries, just like the doors open so we can get a couple libraries? Have them so we could get the library cards to seniors who don't really know how to use computers, so they could go check out some books. Like my in-laws they prefer books anyways. Is there any way they could do that?
Kevin, thanks so much for your question. And libraries, we're big users of it actually in our house with our children especially. And I would love to do what you're saying. I would. In fact, closing the libraries was early on one of the harder decisions that I had to make. And all of these decisions are judgment calls. So I'm not going to say there's like a right or a wrong. But I do know that the libraries were at the intersection of, a vulnerable population where kids and elders would often mix. That was a challenge. There also was an issue around the surfaces of books, and that sort of, there's debatable science on, how long the coronavirus lasts on the surface of a book and things like that. And obviously we can just wipe them down. But we did make the decision to close them. And I think the real person to speak to your question going forward is our director, happens to be on the phone, the head of all our libraries in her department, Cultural Services, is Dr. Shel Sanchez. So Shel, if you'd like to comment on this, go ahead.
Yes, thank you, Mayor, and I do very much appreciate your the callers' interest in the libraries and getting them open as soon as possible. I can assure you that's what the entire library staff and the director of our libraries, Dean Smith, are looking every single day, looking nationally and internationally, because all of the library systems across our country are struggling with the same questions. How soon can we get them open? I can tell you we're already making decisions to ensure that we can open as soon as possible. We're putting in, the kind of the screens between, the see-through screens between our visitors and our librarians. So as soon as we're open, we can give everybody a little more safety. We're already making those kinds of things, so we're ready to open when really the public health officials feel like it's time. I have elderly parents as well who were like, hey, is there any way that we can just check out books? And we just haven't been able to find a way that keeps the community safe and our librarians safe as well. But we are very actively working on the plan that the minute we have the clear from our public health officials, that's going to be one of the very first things that we invest in quickly in terms of our time to get open for the public. We can, for people who are able to access things online and don't have their library card, you can call as long as you're a resident of our service area, which is basically the Albuquerque area. You can get your library card over the phone. We can walk you through that on the phone. We have to mail it to an address here in Albuquerque, so that's the only people we can serve through our libraries online. So that's something we can do, but otherwise, like everything else that we love in our city right now and all of our cherished spaces, we all just kind of have to wait. Thank you, Mayor.
Great. Thank you very much, Director. And we will go to our last question and then hear some closing remarks from Mayor Keller. We do want to let you know that if we didn't get to your question, you'll have the opportunity to leave a voicemail for Mayor Keller when the call ends. So just stay on the line and you'll be able to leave that voicemail. So real quick, we're going to go to Mary, who's got a question about carriers and antibody testing. Mary, go right ahead.
Hi, thank you for taking my call, and thank you for everything that you're doing, Mayor, and your staff, and all the public safety people and the hospitals and everything. I believe that I got this bug in December because I was very, very sick, but I was by myself, and I had a high fever, and I wasn't able to call 911. I had it for 72 hours. Praise God that I survived. My question is, how do I know if I've already had it? And if I've already had it, am I immune from it now? And also, could I be immune from spreading it to anybody else?
Great.
Hang on, one more thing. Sorry. I'm disabled, and I do yoga every single day. Sometimes I go to the class, and I'm the only one in the yoga studio taking the class, but I have to do that for pain management because I don't take any pain medications for all the herniated discs in my neck and my back. So my question is there any way that businesses can open up where they restrict the limit of customers, such like yoga studios and other places that could keep it down, especially churches too. Churches are very important for spiritual needs right now, that they can restrict it to 5 and under at a time in the buildings. Is there any way that we can start doing that and integrating that? Thank you again. That's it. God bless.
Thanks, Mary. Appreciate it. And just also glad to hear that you got through, whatever you had, even if it was this. Absolutely just grateful for that. So to your question, a couple of things. Dr. Mark Dimena is really the expert on this, so I'll tee him up to comment on the medical side as well as a little bit about the questions around yoga and so forth. That's really his wheelhouse. So, Mark, why don't you take it over?
Thanks, Mayor. I'll go to the quickest part first. As far as in studio yoga, anything where you could go to the business, and the same thing is going to apply to houses of worship and that type of thing. It's really absolutely up to the governor. The public health orders are statewide, and we have to follow those. Strictly speaking, it is really the best thing for public health. And as we heard earlier, enforcement is a little bit of an issue even with the places that are essential businesses. So it really just becomes a very slippery slope, and I think that's unlikely to change. With regard to your, wanting to do yoga or something for pain, I think, the best that we can offer, the best we've been encouraging people is look for some of those online resources. There are some YouTube videos that can kind of help you do some of that type of thing at home. And it's a little bit of an interesting way to do it, not necessarily everybody's first choice, but on the plus side, there's a tremendous amount of resources available out there if you can find a way to get into it. I'm going to try to be as brief as I can on the antibody question, simply because this is one of my favorite topics right now, and I could have hogged up the whole call talking about it. We have definitely heard other people talking about having something that very much resembles COVID-19 symptoms, course of disease, that type of thing, going back as early as December. There was an interesting article that I saw this weekend where there is some evidence that it may have been circulating worldwide far sooner than anybody realized. I think you'll probably see some better science coming out on that in the coming months as the immediate crisis resolves. But if you really, want something to keep yourself awake at night thinking about, it's hard to imagine that it was entirely controlled from leaving Wuhan, China, where it started in the strict and controlled fashion that people talk about. So it is definitely not out of the question, and maybe even likely that there was some leakage of some virus around the world earlier, but there's nothing to confirm that yet. There will be antibody tests that are going to be available and actually approved. There's lots of antibody tests that you can get online now. I'd encourage you to look at the city's website. We have a bunch of information of all different types, but one of the things that we cover, and we did a little press release on this the other day, there are lots of tests out there, and none of them are FDA certified, none of them are proven, and some of the reliability has been called into question by people trying to actually test them. So I would, there's nothing that's approved for at-home use. At some point, doctors may start having access to these antibody tests, but wait for the stuff that's blessed and certified and legitimate, and that's how people will be able to go back and find out if they have been positive in the past, if they have already had the disease. The jury is still out in terms of long-term immunity, how long this will actually be protective, or whether or not it can prevent you from infecting other people. The reason that I said this is my favorite topic is because this is going to have a lot to do with how we determine when it's safe to start sending people back to work and what the outcome is going to look like longer term. So I think you'll start to hear a lot of that in the news, and we'll be talking about it as well. The state and the governor will be talking about it coming up in the near future as those tests become available and we start seeing what kind of information they can provide.
Great. Thank you, Dr. Dimena. We're going to hear from Mayor Keller with a few closing remarks. And again, if we didn't get to your question, you'll have an opportunity to leave a voicemail for the mayor. Mayor Keller, go right ahead.
I think first I just want to thank everyone again for taking some time out of their day to listen to this discussion, for some of you to participate in it. And it's something we're going to continue to try and do, every week or so. We'll try and have different times available, some weekends, some evenings, some during the day. So we want to continue to try and stay informed and keep everyone as up to date as we can. If you didn't get your questions answered today, 311 is always a good resource. And we actually have a very good website. I know there's a lot of pointing to websites going on right now, but cabq.gov has a pretty organized all things Corona header right up front. And so check out that if you have more questions. And beyond that, want to wish everyone the best through this difficult time. I know we're a strong and resilient community, and I know we're going to get through this. And I think we're learning how to do it, and we're learning that we can do this and that we will be able to get through it. It might take a few weeks for sure. It might also take a few months. But down the road, late summer, we're all going to look back and think about how we all came together as one Albuquerque to get through this tough time. So with that, we'll look forward to continuing the discussion and want everyone to stay healthy and safe. Thank you.
Thank you, Mayor, and thank you to